Also, the board appointed a leader to each group. The leader was the responsible for conducting the group in all the phases of the process. Once the group were made up, the pre-consensus work started. A total of 170 people registered was reached. In order to facilitate the pre-consensus discussion among the members of the groups and to encourage more physicians to participate, especially those who lived out of Santiago, the capital city, the Chilean Society of Breast Diseases established a strategic partnership with a company called MedWave Studios or MedWave Studies that provided a virtual platform which handed the participants several tools like forums for discussions, places to post and share documents, exchange opinions, ask questions, etc. Each group had an own forum. Also, MedWave Studies provided methodology counseling. Pre-consensus work started by July 2008 and consisted of the following phases: search of the literature to identify and summarize the best evidence available regarding each question, classify and summarize the evidence available, and formulate recommendations enclosing the respective bases. Each of these phases had to be achieved within a period of time, and a deadline was defined to hand the assignment. At the beginning, many physicians had traveled to use the platform. Many were reluctant to work in this way. Many had to spend some time in the know-how of the use of the platform. But anyway, and finally, 16 pre-consensus reports were written, one per group, ready to be presented in the meeting. The meeting was held in August 2009, 1 year after the work of the group started. 16 pre-consensus reports were presented so the audience could comment on them, ask questions, and make suggestions about the recommendations. After the meeting, the authors incorporated the observations done during the meeting. This led to 16 post-consensus reports that underwent a last author review, then an editorial board review, and finally, the publication that can be found in our web page, the www.mastologia.cl, or this book just came up before I came last week. Simultaneously, the Ministry of Health took most of this guideline and turned it into the official ones. Finally, I would like to highlight that the treatment recommended by the current guideline must be covered by both the public and the private health insurances of the Chilean people according to the law. About 80% of the Chilean people receives the medical attention in the public system. And in this picture, you can see most of the team which I work with to achieve this tremendous challenge. Thank you for your